I am Dr. Amanda. I am making sure I am live here. If you can hear me, say hello. If you're watching live, looks like we are live in the chat. All right. So, high blood pressure is what we're going to talk about today because high blood pressure I just got a message about how it is like one of the number one risk factors that we can modify to decrease our risk for heart disease. And it is a big topic, especially in the African American community, on how our blood pressure actually is causing havoc in our lives. Okay. So if you do not know me, once again, I am Dr. Amanda. I am a internal medicine and lifestyle medicine physician and also owner of Atkins Enlightenment Lifestyle Medicine, where we help patients just like you have high blood pressure to get off medications safely and to learn how to do that naturally with our foods and lifestyle. And so, yes, lifestyle can actually help decrease our blood pressure and support it in so many ways where we're not as reliant on medication. Okay. So, if you're a person that is looking to actually decrease your medication or to get off your medication, you want to stay and listen to all this that is going on here. And if someone that you know has that, you want to tag them in this video so they can actually start watching it and see what's going on because we want you to actually live out your God-given purpose and not be so reliant on medications. Now, medications can be good for some things, but there's some things that we can do that actually can help change our actual outcome and decrease that blood pressure. Why do we care about blood pressure? Like, oh, it's okay. I don't feel anything anyway. And blood pressure is called the silent killer for a reason. You don't know sometimes that you have high blood pressure until sometimes something catastrophic happens. Unfortunately, when I was actually going through training, I had a patient just in his 40s that had a massive stroke. Did not know his blood pressure was high and how devastating that was for his family. And of course, himself, that now he is permanently disabled because he did not know he had high blood pressure. And what we call now the prime of our life in the 40s, and now permanently disabled because his blood pressure was out of control. And again, something that we can do about it. We do not have to just say, oh, here's, 3 pills, here's 5 pills. So the combination of pills that you can take to get your blood pressure down, which again, I am a physician. I was taught that we diagnose, we treat, we give you medications that sometimes it is safest to go on medications initially, but I also want to empower my patients to make sure that they know that they can take charge of their own health and actually make some changes in their own lifestyle to actually get that blood pressure down while still be on medication, but then slowly come off the medication. So the number one thing that I like people to know about blood pressure, that they may not know that they're like, what can I do to bring my blood pressure down? Is of course, what are we eating? And it is different things in our diet that can be causing our blood pressure to go higher. And we all know about sodium. So I'm just going to start there. Salt in our diet. And most time we're like, oh, I'm not going to add salt to my diet, or I can't eat this food if it doesn't have salt in there, or anywhere in between. You can be anywhere in between of that. But we have to know that sodium could definitely cause some issues in our blood pressure, causing more inflammation in our body. Now, sodium is good for preserving things. And so that's why you may not notice that it's in a lot of foods. It's in a lot of foods that we actually eat. And you're like, I wouldn't think this amount of salt or sodium would be in the food. Where it can be hidden is in like processed foods, of course. So because they're trying to preserve the foods and certain breads and sauces and different snacks that we like. So those chips that, this you just can't eat one here found in there. But what can we do instead is actually eating more whole foods. Try to prepare food with different herbs and spices. So a big thing is like um, vinegar and garlic and onions, which are huge, lemon, spices, different things like that. My husband is now starting to use truffle, and it's different things you can do to add flavor to your food besides salt. Okay, so you want to be very careful with the amount of sodium that's in your food. That's definitely number one. And then I like to say, foods that we also eat or choose not to eat, we want to try to do more potassium rich food. So less sodium, more potassium. What does that look like? My lovely green leafy vegetables like spinach and kale. Also, I love like sweet potatoes. These things, not the sweet potatoes with the extra sugar on there, but just like a sweet potato has natural sweeteners. So, I mean, not added sweeteners. It actually tastes sweetened. That's why it's called sweet potato. But these types of foods that are higher in potassium can actually help decrease your blood pressure also. So you want to look at those things. So less chips and more sweet potatoes. It's still a potato. You can still have that. And you could do that no matter what. And you want to actually look for lots and lots and lots and lots. And did I say lots of green leafy vegetables? You want to try to have those with every single meal because our green leafy vegetables have a natural thing in there like nitric oxide, which is a hormone or a element that actually dilates our blood vessels and actually helps decrease our blood pressure naturally. So if anything else, if you don't get anything else from what I'm talking here, you want to make sure you're eating lots and lots and lots of green leafy vegetables and green leafy vegetables all the time, every day, multiple times a day, every single meal, snack time. Instead of our other like snacks of chips, we want to be eating snacks of green leafy vegetables. And you would be amazed at how much your blood pressure can decrease in a short period of time if you just substitute these few things out. So this is the biggest change you can make because your foods that you take in impacts a lot, a lot, a lot in your health. And you want to actually do foods that are natural anti-inflammatories. So again, the green leafy vegetables decrease the inflammation in the body, not just decrease the inflammation, not just dilates our blood vessels, but it actually heals damaged blood vessels. Can you believe that? So because we've been eating all sorts of things, doing all sorts of stuff to our bodies for years and even decades, our arteries are very damaged. And because we cannot see them, we think, oh, it's not that bad. Again, we think high blood pressure is a silent killer, but the constant damage, the constant hit that our blood vessels take, it is very scary. So just think about it. If you cut your skin, you actually can see, like it starts to bleed, and you can actually see that there. You can see that that it's injured, that it's hurt, and that cells come there, it's inflammation, and it's trying to actually help heal. And then next thing you know, you may have a scar, or you don't have anything. You're just like, oh, now it's healed up all the way. But that's because your body was able to cover that up and you actually did something to actually help nurture that healing, right? But say on the inside, because you cannot see, you don't know that your blood vessels, which I'm telling you that there are constantly being damaged by different stressors from the foods that we eat and other stressors that we're not going to go in today, but there's a lot of stressors that can go, but food is the main thing. And actually, the green leafy vegetables can actually help heal that. So, what we think of like damage to the outside of our skin, think about that as inside your blood vessels. And think about eating the green leafy vegetables as it goes through with their little, I was like, little thing here, and actually like healing the actual lining of your blood vessels. So, where it's gaps, where it's injured, where it has where we say, well, it looks like blood, but it's in the blood vessels. And your body, your green leaf vessels goes along and that patches those things up. The nutrients inside there patches that up. So that way your body is not constantly trying to heal different places. You know how when you feel overwhelmed when things going on, say you're at work and your boss throws at 20 different things that you have to do today and have to get done today, and they're not related. They're all in different. They go in different directions, and they expect you to get it done. And then the next day they do the same thing. You would end up quitting that job, right? Well, your body is trying not to quit on you. It wants to stay alive, but you keep throwing it in so many different directions with the different foods that you eat and causing damage. And they're like, where do I go? Like there's damage everywhere. There is damage everywhere. How can I actually do better and actually help my body? And that is where the green leafy vegetables come in. So we talked about how salt in different foods processed foods, breads, and things like that that has salt in there that actually can cause damage, and what you can do to actually reverse that damage. So again, the green leafy vegetables is the most important thing that you can eat that actually helps bring that blood pressure down. So decrease the salt, increase the green leafy vegetables a lot, a lot, a lot. So I did not want to be on here long. So hopefully you learned something that's good for your blood pressure. And we'll be coming back here talking about more things that you can do to help change those different illnesses in your body for your own good health and well-being. And again, I am a physician. I do prescribe medication, but I'm trying to empower my patients to actually learn what they can do so they do not have to rely on medications, and therefore make my job easier and make you healthier. All right. So if you're someone that's looking for a person like me to actually help you personalize your treatment plans for your either high blood pressure, diabetes, weight management, what you may think, that is what Atkins Enlightenment Lifestyle Medicine is here for. It is a virtual practice that is here to actually help you to actually learn these things about your own body and tailor your actual plan to your actual situation. So you can go to my website at www.dramandamd.com and book your appointment today. So I look forward to working with you in the near future, and I will talk with you soon. Blessed and health, y'all, and I look forward to seeing you on the next video.